I will be presenting overdose creep. What is dose creep? Dose creep plays a large role in imaging. It contributes to scatter radiation and radiation absorption. Advancements from CR to DR have played a large role in the increasing amount of dose creep. ECRI's Top 10 Health Hazards of 2015 describes dose creep as a pattern of radiation exposure levels being increased by clinicals over time in an attempt to achieve better image quality in diagnostic radiography. Where is dose creep found? Dose creep can be found in digital radiography. Midwest Medical University goes deeper into one disadvantage of the change from CR to DR. They state, unlike film, which turns darker black when overexposed, a digital X-ray image becomes better when overexposed. To avoid the appearance of noise associated with underexposed images, technologists may inadvertently increase dose, leading to dose creep. Dose creep is also found in the clinical setting. In the same article mentioned earlier, written by healthmanager.org, ECRI states that digital detectors, by comparison, are more forgiving because they have a much wider dynamic range than film. They can tolerate a significantly wider range of exposure parameters and still return a usable image. What is the importance of dose creep? The importance of knowing dose creep. Although dose creep doesn't have immediate side effects, it can harm in the long run. If a patient comes and gets exposure x-rays once a year and we're dose creeping them every single time, it will start to build up. Science Direct's article, Digital Radiography, the balance between image quality and required radiation dose explains. Digital techniques increasingly offer options for dose reduction. At the same time, there are risks of substantially increasing the patient dose, possibly unaware due to the lack of visual control. Therefore, implementation of dose indicators and dose monitoring is mandatory for digital radiography. Although we want the best images possible, we don't want to overexpose our patients. We want our patients to have the best images so they can get the best diagnosis. Why do I need to know dose creep? Dose creep prevents overexposure to the patient, which lessens patient dose. If we're lessening patient dose, we are also lessening Compton scatter, which contributes to us as text dose. ASRT states, radiography examinations represent 74% of all radiographic exams and contribute to 40% of all radiation exposures. Who controls dose creep? You, as a future tech, are the controller of dose creep. You are actually the main controller. How do I, as a future tech, limit dose creep? A way to limit dose creep is to review the exposure indicators provided by the imaging system. Make sure that after your image is taken, your exposure index is within the range. If you are unsure of the range, refer to your clinic badge. ALARA is another way to limit dose creep. ALARA stands for as low as reasonably possible. The ALARA principle reduces instances where one may overexpose or underexpose a patient. Make sure you're always using appropriate techniques based on a patient's size and condition. Remember, don't dose creep. Although dose creep is unintentional, we need to be conscious of the technical factors we are using. The increasing technology shows why we are taught practices like collimation, exposure index, and ELARA. They can help minimize a patient's dose creep. Thank you for listening to my presentation.